Okay, so this is a basic IV insertion for a saline lock. So you're going to have your IV start kit here. You're going to have some kind of extension tubing for a saline lock. You're also going to have, we're going to pretend that this is a 10 ml syringe pre-filled with normal saline. If you need to draw blood, which you will be drawing blood when you start IVs in OB, you will have a Lure-Lock adapter access device. Okay. We have an 18 gauge here. This is your IV catheter. And you guys have pink ones because they're 20 gauges. So 18 or 20 is fine. And then I just have some blood collection tubes to simulate what it's going to be like in the clinical setting. So first thing is, we want to open everything up. We want to have everything ready because then we are limited to opening things once we have our gloves on. Okay, so open all your packages. We're going to pretend that this is a Chuck's pad that you have. All right, so first thing we want to do is prime our extension tubing. So this would normally have a cap. We would take it off. Then you just want to attach. Now this is still sterile because it's out of the package, so you don't have to clean it as long as you haven't touched it. Okay. Then you're just going to push the fluid till it comes to the end here, and you want to loosen the cap, and you can see the liquid kind of right there at the end. So you want to loosen the cap because when you're working one-handed, when you need to attach this, it's really hard to take off with just the one hand. So just take it off and put it back on very loosely, and you can leave it kind of right there over the plastic, and that's ready to go. Next, we want to set up our tape. So we always get rid of this little piece here on the end. We don't need that. And then we're going to take our first piece, tear it off. There's no exact measurement, okay? And then we just want to rip it in half. So we have two skinnies, and I'm just going to place those here at the end. We would have them on our tray table. And then we're going to have a longer piece, okay? So you want two skinnies, a long, and then you want a short, and that's if you have your IV fluids infusing, but I'll still show you what that would look like, okay? And then we just leave this here in case we need it. We have our tourniquet, so we're going to take the rubber band off of that, have our tourniquet ready to go. We have a chlorhexidine, okay? And you might have a pad, a chlorhexidine pad. You might have a little crush vial, something, or a little scrubber, okay? We have our Tegaderm. So this is what's going to be our sterile dressing over the IV site. And then we also have a couple of 2x2 gauze. So you want to have those ready. Okay. So first thing is we want to go ahead. We've already done all the identification measures. So we want to get the patient's arm. If you're doing forearm here or wrist, you want to have the tourniquet right about here. You always want to go below the elbow. You don't want to put the tourniquet right on the elbow, okay? Also, for OB, we never put the IVs here. That would just be too easy, right? Women are typically bending their arms, holding their legs to deliver, or they're holding the baby afterwards to breastfeed, and it occludes very often. So we always have to go forearm, wrist, or hand. So tourniquets you want to put on without gloves. It's very difficult to do a tourniquet very well when you have gloves on. It always kind of gets caught. So do the tourniquet first and then put your gloves on. So to put the tourniquet, we're going to just cross. We're going to make this X. You see my fingers under here. I'm going to put my thumb on that middle of the X, and then I'm going to take these fingers and push that little loop in like so. Okay, and you can replay that over if you need to keep practicing, or you can practice on someone. At least putting the tourniquet on is okay. Once the tourniquet's on, we want to go ahead and put our gloves on. So I have my gloves on, and I'm going to go ahead and see which vein looks good. Okay, I'm not real big on the whole like tapping. You may have seen that in movies or things like that. But sometimes if you just kind of rub the vein a little bit, it'll get warm and it'll start to get a little bit more spongy, so where you can see a little bit of bounce and feel a little bit to the vein. So that's what you want. So once we've selected which vein we're going to use, we want to go ahead and get our chlorhexidine. And just for simulation purposes, I'm not going to open this, but you would do a good cleaning of the site. Okay, let that dry for just a second. Then what I'm going to do next is I'm going to go ahead and take off the cap, and just the same way you've learned with needles, you're going to go out like that. Now here you can see the catheter is designed a special way. So this is your chamber to view, and this is where you're going to see the flashback of the blood come in so that you know you're in a vein. These curves here are designed right for your fingertips, okay? So you do not hold it like this. You do not hold it like this. It's designed this way for a reason, so you can hold it to get that right angle, and so you can still see the flashback chamber with blood. This white button for you at home right now, for purposes of reusing for practice, stay away from that white button. That's the safety, okay? So make sure you don't hit it so you can keep using this to practice. Now, what you can do is you don't want to touch any of the white part. That's the catheter that actually goes into the patient's vein. But this part you can touch. And we always, as nurses, like to just kind of pull back and make sure it's loose. Never have encountered a faulty IV catheter, but there is always that chance that maybe it could be, the plastic could be stuck to the needle. So as nurses, you'll always see us kind of loosen a little bit just to make sure that the catheter glides off of the needle. So my site is cleaned. I've already explained to the patient. I'm going to pull the skin, okay, from lower. And I want that 10 to 15 degree angle as if I was doing a TB test. It's that same angle. So you almost want to pretend like you're landing a plane. So if I want to start it right about here, then I'm going to start kind of lower, okay? You will see different techniques. Some nurses you see will come in pretty at a sharp 45 degree angle, and then once they're in the vein, they'll drop in lower real quick. But I don't think that you're ready for that technique yet. Also, some nurses will do a side swipe, so they go in along the side of the vein and then swoop it in almost if you were changing lanes. But I don't think that that's a good technique for students starting off either. So I highly recommend that you use a TB, almost landing a plane type of an angle, okay? So let's go ahead and get started. Pulling the skin, gonna go in. And then right when you're in the vein and I see blood, I'm going to pretend that I see blood. I want to just advance a little bit more. You want a good amount of the catheter in. Then I'm going to get my other hand, okay? And as beginners, I don't recommend the one finger slide. So nurses, we do a lot of the one finger slide. But for students, it ends up just being really bad and it doesn't glide in as easy for some reason. So to start, I want to see these two fingers. They're going to come over, and this hand is frozen. The needle's not going to move anymore, okay? This hand, I'm going to push the catheter in all the way so it's flush to the skin. Now I need to imagine where that end is because I need to put pressure on that vein because the blood is going to start pouring out right now, okay? And we don't want a lot of blood loss, so that usually makes the patients pretty nervous and scared. So you want to push hard, and trust me, you have to push really hard. And you want to use these two fingers, and I know that these aren't your strongest two fingers, but I'm going to explain why we use these ones, okay? So we're going to push really, really hard right here. This is going to glide out, and as I'm sliding out, I'm going to hit that white button so I have a safety. So this is completely safe, and I can put it in the sharps later. At this time, I need to get this adapter on here. So that's why I have these two fingers to hold this to screw it on, okay? If I didn't, and I was putting pressure with these two fingers, let's rewind. If I was doing this, how would I get this one on? It would be really uncomfortable. And when this turns inside the patient's vein, it's uncomfortable. So pressure here, hold here, twist here. Once this is on, blood's not going to come pouring out. Okay, that's keeping it from coming out. So I'm going to switch over and rotate my hand here, and I'm going to put the tube in. I always want to put the tube so I have the window so I can see the blood flow. So I'm going to put that here. These two fingers are going to go on these wings here, and I'm going to push, and I'm going to fill up the tube with blood. I'm going to take it out. I'm going to get the next one in. And you want to have good control here with this hand because you don't want that patient to feel the jabbing back and forth. That's going to be uncomfortable for them. Two fingers on the wings, my thumb on the bottom of the tube, push, blood is coming out, take it out. Next one, I can see the window, two fingers, push, blood is coming out, take it out. Now, I can switch hands and I can take the tourniquet off. And I always like to put a little 2x2 underneath just in case a drop of blood comes off. But normally I try to be really careful and not make any mess whatsoever. But just in the beginning, just know it helps to have the little 2x2 right there. Pressure again with these two awkward fingers, okay? Then I'm going to take this off. And remember, once I take this off, this is open to have blood coming out. I'm going to put that down. I'm going to now have this tubing and see where the one-handed cap kind of comes off nicely because I loosened it. And then I'm going to attach. Now that I've attached, I can let go of pressure. I can hold it here at the end. I'm going to screw on the tubing there. I can take this off. If I have any extra alcohol swabs and gauze, I can clean up any mess that I might have. And then I need to do my tegaderm. Now, to do the tegaderm, you don't want, the patient might be moving, they could be thrashing, so you never want to let go, okay? And you always want to be able to see this site. So I don't recommend holding it like this because then when you're trying to put the tegaderm on, you're just blocking yourself. And a lot of times as well, what happens is when students aren't focused, then they look, they're doing this, and then when they move their hand, that's what it looks like. And we don't want that, okay? So always make sure that this is in your line of vision. You always want to see that. So I recommend holding at the end like this, almost literally like a cigarette, okay? Promise I've never smoked, but this is what is a good hold because it allows you to peel off the backing from the tegaderm because this is sterile. So you never want to touch anything there. And then you're going to cover, for OB, you want to cover a little of the attachment adapter here because we don't really change the tubing because they're obviously going to be discharged. But for Med-Surg, you would only cover the colored portion because the tubing will get changed according to hospital policy. So we're going to pretend this is OB and we're going to cover right about there. You're going to put your tegaderm. Now I can touch and let go of the tubing. I'm going to peel this off like so. Then I'm going to get my skinny piece of tape and I'm going to just reinforce and go right over the insertion site. I'm going to get my next skinny piece and go right over the hub right there. I'm going to push and flush my normal saline. You would push all of it, but for simulation purposes, I'm not. Then you can disconnect and then you can clamp. Then you're going to use your long piece. because we don't want to leave this dangling. So you would use your long piece and go over and secure that down. You don't want to have a big portion of the hoop out and protruding, because patients can get this caught in door handles. Then if you had more tubing going to the IV pump, you would then put another piece of tape over that tubing that was going to the IV pump. Okay, you're going to get this, you're going to fill it out, you're going to put your initials, the date and the gauge. Then you're going to take it off and you're going to put it right here on the side. You never want to cover the actual insertion site. All right, that's pretty much it. Now looking at to take it off. Gloves on, obviously. I always get the old tape and just put it on the back of my glove instead of sticking it on their bed. So you're going to just take everything off piece by piece. And you want to hold it because you don't want to pull on that IV, because that is going to be uncomfortable for them. So you do want to make sure you're holding it. Take everything off. I'm pretending I have gloves on right now. I have a 2x2 and I would have a piece of tape ready. Okay, then I'm going to peel this off and holding the catheter so it doesn't get pulled with that Tegaderm. Gonna pull off and away, like so. Back of my glove. I'm gonna put my 2x2, put some pressure, pull out slowly, don't pull out fast, because what's gonna happen is it's gonna flick and blood is going to kind of flick towards you. So pull it slowly, and then you're gonna put some tape and tape it down with a lot of pressure. And of course, as always, document everything you do. I hope this helps. Bye.